Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up healthcare. Karine Jean-Pierre and health experts warn over Trump's cuts costing LGBTQ lives. The Trump administration is once again putting LGBTQ plus lives on the line, this time in proposing to eliminate funding for the LGBTQ subnetwork of the 988 Suicide and Crisis Lifeline. That service has already supported over 1.2 million queer callers in crisis. But starting October 1, a leaked budget shows that the lifeline may disappear. Speaking with the advocate, former White House press secretary Karine Jean-Pierre said, quote, "For countless LGBTQ plus individuals, the crisis line isn't just a service, it's a lifeline. It's what stands between despair and survival, isolation and hope," end quote. She warns that stripping away this resource would be devastating and the lives will be lost. Mental health experts agree. Mark Henson from the Trevor Project says LGBTQ plus youth are 4 times more likely to consider suicide, and the specialized services exist because of this risk. After the 2024 election, calls to the Trevor Project surged 700%. And Lance Preston of Rainbow Youth Project says their teams are already overwhelmed, fielding over 9,000 calls a month. Experts stress this isn't about politics, it's about survival. Dr. José Bauermeister warns, quote, "Dismantling targeted support services under the guise of neutrality or efficiency ignores the evidence. Equitable mental health outcomes require tailored, cultural, responsive interventions," end quote. Advocates urge that the administration to reverse recourse. It's just amazing to me because I look at it constantly. We've heard so much about the Trevor Project and so much about our youth, and mental health experts agree that dismantling targeting support services ignores the evidence. It really does. Mm-hmm. And it has such an impact on our community, from a lack of specialized care resulting in poor mental health outcomes and increased vulnerability. And we have seen that time and time again in our community. We have talked about mental health around this table so many times, and the risk of suicide. And it's nerve-wracking to think that let's just defund this. And
yeah. I mean, I totally get people are going to die. Mm-hmm. Jewish Community Services operates the 988 hotline in Miami-Dade County, and calls every single day, calls rising. I can say that every one of the counselors that answers 988 at JCS are trained to deal with LGBT callers, and I would hope that in many other 988 centers around the country, they are as well. But this is vital.
Yep.
This is really vital. And the last thing you want to do is not be able, for those who are reaching out.
Right.
I mean, so many don't even reach out. But when someone reaches out, if we can't help them, what are we as a society?
Right.
I mean, making decisions about mental health by an administration with somebody with a mental problem is certainly not ideal.
Right.
And we're looking at creating despair amongst the most vulnerable in our community. And again, it's part of the playbook. It's part of creating fear. It's part of making people shelter and not put themselves out there. I hope if this does happen, we do see support from the private sector to come out and save this, because what could be more, I mean, it's, the list of things that are one worse than the next happen on a daily basis.
Right.
So it's hard to keep up, but, again, these type of services, and again, especially from our community where we're already being attacked and already under the gun, you're going to have a rise in suicide just from that in general, and not having resources in schools that can help, or not having resources in the workplace because they're not wanting to put out DEI, support.
Right. And not even in the libraries.
Yes, and exactly. Or not even having books that you can take out in places. And so there's so many ways that they're trying to create fear and despair. And this is the most disgusting one.
Right.
Yeah.
It's going to have to be the medical community is going to have to step up even more in some way, shape, or form, whether that's their own, practices that have, mental therapy services. It's going to have to come down to that. A lot of these things were never funded originally by the government, and luckily they've built to the point that they got funded because they showed the importance. And it's like, if they knock it back, it's going to have to go back to that again. It's going to take that grassroots movement to get these things funded, I feel.
Yeah. I mean, mental health sometimes is a dirty word, right? People don't like to talk about it openly. As somebody with a lived experience in mental health, right, I have suffered, right, with my own experiences, and I think the community, right, we've had members of the community that are scared to talk about it, right, because of stigma. They're scared to, be vulnerable and be open about issues with mental health. I mean, we need this funding. We need these programs. We need these services, right? Like, we shouldn't be, with a hammer clamping down on these services when members of our community are struggling. And a lot of times it's not apparent, right? It's very hush hush. Don't talk about mental health. There's stigma associated with mental health. As a mental health advocate, I try to tell people to be open about their lived experiences, but there's a lot of members that are going to suffer from this.
Absolutely.
I agree. I agree completely.
Absolutely.
Yeah. Well, that is a big LGBTQ story for today. There is no other queer nonprofit media platform like